Hello, Dr. Miaken of Monarch Family Chiropractic. Welcome to this week's workshop talking about joint health. And Dr. Kristen recently did this topic in the last 6 months, really diving deep into joint health, nutrition, and making recommendations in terms of supplementation. Today, I want to do a shift on understanding joint health. Dr. Kristen and I and some of the team recently came back from our annual convention where some of the top scientists in chiropractic research presented, and their findings are pretty awesome for us to share with you, especially as chiropractors, because what we're finding is we focus on the adjustments and how it impacts the body and the body function. But what's actually happening, based on what the current research is showing, is that when we deliver an adjustment, it is changing your brain, which is super cool. Every time you get adjusted, we are improving the brain-body connection so the brain can better understand where the body is in space, better coordinate movement, better handle executive function like decision-making, goal-oriented tasks, how you perceive pain, how you respond to emotional stresses. And so super exciting information that we think is vital to share with you, because chiropractic is not just about your spine, it's about brain health. And so we are brain-based chiropractors, and when we deliver adjustments and when we are correcting and adjusting your subluxations, it is impacting your brain, which is super exciting. So how does that happen? That's where joint health is going to come into play. And let me just bring me up here. Happy Halloween. We're celebrating here. And so one of the top researchers, her name is Heidi Havoc, she really broke it down for us to understand how it impacts the brain, okay? So I'm going to first show you the spine, okay? We're going to talk about the joints in the spine today. And a joint in the spine is basically where two bones meet, okay? So here's the top of your head. You've got C1, 2, all the way down to 7, and then into your mid-back. So a joint is basically where two bones meet, and how they articulate and meet and how they move, allowing for motion in the body, coordinated movement, okay? So here's 3 segments. And again, here is a joint, how this lumbar vertebra sits against or articulates with this joint of a lumbar vertebra, how these fit into place. So we call these the facet joints back through here, and allows for motion and movement of that spine, both rotation, lateral flexion, and extension. Now, depending on where you are in the spine, you see more motions, maybe in rotation, like up at the upper cervical spine, we expect 80 degrees plus rotation in your upper cervical spine. In your lumbar spine, your lumbar vertebra don't go into that degree of motion. You know, they go into 6, 7 degrees, but there should be range of motion within each joint. Now, when you have motion into these joints, that means there's blood flow, okay? So your joints and the type of tissue that surround those joints are oftentimes not very vascular, meaning there's not a lot of blood flow that happens through here unless there is movement, okay? So if you have a subluxation, that alters the blood flow. It alters the motion. It actually impacts or disrupts how this spinal segment or this joint moves, which, number one, alters the information that the brain receives, but it alters the blood flow. And so when you have healthy movement into a joint over and over and over, that is supporting good blood flow to that area, which is supporting good nutrition to the joint, which is appropriately lubricating the joint, appropriately giving the joint healthy input, and it is giving good neurological input and sensory input into the brain, so the brain understands what's going on in this area. And so number one, I would say, in order to have healthy joint nutrition, you need to have healthy movement in the spine, okay? Because healthy movement brings blood flow and it brings nutrition to that area and keeps that joint lubricated and in good motion. Okay, if you have subluxation, then that impacts all of those things, ultimately impacting the brain. Now, this is where I'm going to share a screen and I'm going to share with you some of the notes that Dr. Heidi shared with us this last weekend. Okay, so let's go here. And I'm just going to read this. And I'm going to make it bigger so that we can all see. So motor control. I want you to think about, you've got sensory input and then you've got output, which is motor control. Okay, so in order for the brain to respond to the environment, you need sensory input. Okay, so this is talking about motor control. Relies on constant communication between motor and sensory systems. It is crucial for spine posture, stability, and movement. So it's crucial for good joint health. Now, adaptations of motor control occur, say, in low back pain. And while different motor adaptation strategies exist, probably to reduce low back pain and risk injury. However, in some individuals with low back pain, when you have adapted motor control strategies, it can cause long-term consequences, which can cause increased spinal loading that has been linked to degeneration of your discs and other tissue, potentially maintaining recurrent or chronic low back pain. So factors contributing to motor control adaptations in low back pain have been extensively studied on the motor output side, but there's been less attention paid to changes in sensory input, specifically proprioception. So proprioception is your sixth sense, okay? It is how you know your hand is behind your back right now, not because you can see it or smell it or taste where it is, but you just know where your body is in space based on proprioception. So what this is indicating is that where we spent a ton of time understanding low back pain as the condition, in terms of what's happening on the motor response, so how the brain is responding, there's been very little time spent on understanding, well, how is this sensory input impacting low back pain, specifically in how our brain understands where we are in space. So what they've concluded is that back pain induced, disrupted, or reduced proprioceptive signaling plays a pivotal role in long-term changes in the motor system and the sensory system and how our brain reorganizes that information. So why is this important? Yeah, I'm going to show you a couple pictures. So what Heidi is sharing in her research, and here's a picture of the occiput, and then the small muscles that attach along the occiput and along C1 and C2. Now, with every joint, there are a ton of sensory input and sensory cells that are feeding the brain information to understand what's happening in that location and what's happening globally. Okay. When you have subluxation, that's altering how those muscles are moving. It's altering the information that the brain is receiving, and it impacts output, okay? So here's what happens. So these deep paraspinal muscles, when there's a healthy segment, they're nice and plump, they're larger in size, it's a slow switch fiber type, meaning it's a there's fast twitch fibers and then there's slow twitch fibers that typically respond for more of an endurance situation versus fast twitch fibers are more of the sprinters. Okay, they respond for short periods of time, they fatigue very quickly. There's no fatty infiltration, it's healthy muscle spindles, and they move really freely. Okay, that is healthy paraspinal muscles, paraspinal being right along the spine, right along the joint, okay, signifies a healthy segment. When you have subluxation, okay, a subluxation impacting these deep paraspinal muscles, the muscles become fibrotic, okay, they become atrophied, meaning they start to break down, they get smaller, and you start to have fatty infiltration. Okay, so they become fattier, and it starts to change the fiber type from slow to fast, meaning these fast twitch spindles start to fatigue quicker, and they aren't, again, fast twitch fibers aren't made to handle some of the load that's happening in the spine. And then you get dysfunction, and that leads to degenerative disc disease around the joint. So what does that look like? If we look at this upper left picture right here, this is healthy muscle tissue right here. So here's we're taking an axial picture. So you're actually seeing what it looks like here. Okay, so if I turn it this way, this is what we're looking at. And then the tissue that attached to it. So here's the vertebral body, and here's the joints. And this is the muscle you're looking for. It's nice and plump. It's healthy and strong. When you have mild subluxation, look at what you see happening here. Look at all of this white color. Look at, here's the belly of the muscle. This is fatty tissue. This is fatty tissue that is infiltrating and actually a muscle tissue that's atrophying. And when this is occurring, what that means is, number one, you're not getting healthy blood flow, you're not getting healthy movement, so there's no nutrition coming to this area, but ultimately, you're not getting good sensory input to feed the brain. And when your brain is not getting good information on what's happening in that joint level, then you start to have problems that show up in terms of symptoms. Okay, so this is mild. Look at what happens when we start to see moderate. So this is a more significant subluxation that's been around chronically, and over time, we're seeing less muscle tissue along here, an atrophied muscle, and a lot more fat tissue that's showing up along here. And again, this is an area of the spine that is not getting really good information to the brain. So we start to see the brain is disconnected and less engaged. And that's where you see back pain. That's where you see chronic back pain. And this is where you see severe atrophy happening. When they're talking about this, they're saying there is, lumbar disc degeneration happening in this area. And there's not a lot of muscle tissue in this case. And so this is the exciting, this is what's exciting about it, okay? Is that when we're going in and locating your subluxations, and we are giving very specific input to correct that subluxation, what's happening is we are firing on that sensory, those sensory cells, okay, that start to feed the brain different information. It gets the brain's attention, says, hey, there's something going on down here, and the brain starts to get better connected to what's happening in that location, and you start to get change, which is super cool. So a lot of people think, wow, thank you, you fixed me. No. Our founder called us the technician, right? We locate and correct vertebral subluxation. We are in no way the healers of the body. You are the healers, okay? We are just taking away the interference to allow the brain and body to do what it's meant to do, which is to thrive and experience a very vitalistic state, okay? So when you're getting adjusted, if we start here and you've got severe degenerative disc and joint disease, you think it takes a little bit of time to start changing what's happening at this location? Yeah, it can take years. It can take decades, and it takes a lot of work and intensity on your part, and it can be done. But how long do you think it took to get to this place, right? And so when we have mild degeneration happening, when you have a curve that's starting to shift and change, and it's in a phase 1 degeneration, somebody says, well, that doesn't really seem like it's that big of a deal. It is a big deal, because your brain is not getting healthy information to support what's happening within the body, okay? And there's greater impacts there. And so let me zoom out here because I want you to see another slide. So we look at what are the three causes of vertebral subluxation. It's the physical trauma, right? The motor vehicle accidents, the falls, the concussions and the impacts that we experience with sports or sitting for extended periods of time. That makes sense to us, okay? And that's why we can understand how a sedentary lifestyle and sitting for extended periods of time can be so impactful to our structure, because it's causing literal breakdown within our tissues that are starting to feed our brain less and less information for our brain to understand and adapt and respond and organize. Okay, you've got the chemical traumas, the inflammation, the toxins that can create subluxation and create these states of interference between our brain and body. And then you've got the psychological, social, and spiritual stress, the thoughts that impact and cause subluxation. So again, chiropractic, we can fall into this physical component, we can fall into this psychological component. And what we see is when you start getting better information to the brain and you start changing the output, then the resilience changes and your ability to respond to inflammation changes, and you start thinking more clearly and you can make different choices, which is really exciting. And I want to show this to you here. This is a busy slide, but I wanted to show it to you. I know we're talking about joint health and we're taking a step back, looking at the whole picture and looking at how vital it is that your joints are getting healthy motion and movement. It is vital. Movement is life, period. You take a river in, the middle of winter and it's sub-zero temperatures, it's below freezing. Why is that river still flowing? It's freezing because there's movement. So when you have movement, that is life. And the less movement you have, the more you're moving to a diseased state. Okay, so we can talk about that spinally. We can talk about that globally in terms of posture. We can talk about that in every joint of the body, your elbows, your shoulders, your hips, your knees, your ankles. And so my focus for this workshop is for you to understand that, yes, there is supplementation that you can do to reduce the inflammation and the toxicity loading that your joints are handling. But if they're not getting motion and movement, you're missing a huge part of joint health, because your joints need movement, they need blood flow, they need nutrition. And when you do those things, that means you're getting good sensory input to the brain, so the brain can do what it's meant to do. Okay, so when you have this vertebral subluxation, it's altering that information received by the brain. Okay, so then you start to have abnormal multisensory processing. Okay, so that multisensory processing could be your pain and temperature, your emotions, your proprioception, the chemistry component and the biochemistry component. It could be the senses of vision, smell, hear, taste, and it could be how you experience past experiences or expectations around the future. All of those play into how your brain is processing and filtering your world. So when you have altered information that is received from a poorly moving joint, it impacts all of those things. And it impacts how your brain is responding and processing, period. So that's the cool thing. When you're getting adjusted, you're supporting good joint health, which, bigger picture, you're supporting good brain information, good brain sensory input, which impacts whole body proprioception, motor control of your ability to manage a healthy homeostatic state. That's temperature, that's blood sugar, that's regulation of all things in terms of your body trying to maintain a healthy state. And that includes neuroplasticity and bioplasticity. It includes resilience, adaptability, function, and overall well-being. That is what's happening with your adjustment. It is so much bigger than healthy joint function and a healthy spinal function. It's about healthy brain processing, handling, what we experience internally with pain and temperature and emotions and proprioception, what we experience with our, big senses, and how we experience past experiences with expectations around the future. So that's where you have people who experience improvement with sleep, with getting adjusted, improvements with anxiety and depression, people who experience improvements with a better ability to process and handle stress, right? We're adjusting your spine, but it's improving your brain function. And, when you break that down, it improves joint health and joint function. So I just want you to have a bigger picture of what's happening with your adjustments, to know that every time you get adjusted, it's improving brain health. It's creating neuroplasticity in a really healthy, beneficial way. And, I guess I don't know all the research out there, but, they have a chiropractor adjusting the spine and looking immediately at what's happening with the brain. And then they do, sham adjustments, light touch or pressure here and there. I don't know how they do the sham, but it's a fake adjustment and they don't get that altered brain input. So chiropractic is so amazing. And I think we can all agree that everybody should get checked. Everybody should be getting adjusted. Everybody needs healthy brain function. Everybody needs more resilience and adaptability, a higher ability to function, a higher experience of their well-being, to minimize the traumas that we are constantly influenced by. Because none of us are immune to these things. They are out there and they are always working on us. And so the one thing that Heidi Havoc, I guess, paused when she was sharing all of her research. She just said, the research that we are finding is that everybody needs to get adjusted. And by and large, people are not getting adjusted enough. So when you are on your care plan and you are following through with the frequency of care, and when you are consistently getting adjusted, whether you're in your first year or your 10th year, because we have people who are 10 plus years into care who've been consistently getting adjusted, I will tell you, year after year after year of good spinal input to change and support healthy brain function, that puts you on a different trajectory. So I just have to honor you today for your choice to be in consistent, continued chiropractic care to support good joint health. But the bigger picture is it is supporting healthy brain function. It is supporting a more resilient brain. It is supporting a brain that can better process all of the things that are going on in your world, both past and your expectation of the future and what you're experiencing, so that you can be a better individual. You can be you, right? You can be you. You can be a better mom, better dad, a better sibling, a better employee, a better boss, better colleague, a better friend, better everything. And that's what we're meant to do here is to live and experience life and to connect in our fullest way. And so I cannot wait to hear your takeaways from this workshop, because I can tell you Dr. Kristen and I and the team were super jazzed on what the latest research is showing as far as chiropractic and how it's benefiting your health and well-being. Not the spinal level, but the brain, right? We impact the brain, we impact everything, because the brain is coordinating and controlling and influencing everything. And that's helping you make decisions on a day-to-day basis. So I love and appreciate you. We have Patient Appreciation Week coming up next week, and I think we have a couple spots left. So this is where I just encourage you to share what you know. Because what we know is that everybody should be getting checked, and everybody would benefit from getting and being under chiropractic care. And the worst thing we can hear is, gosh, I wish somebody would have told me this. Why didn't somebody tell me sooner? And you know, the best time is now. So thank you for being a part of our practice. We love and appreciate you. Dr. Miaken of Monarch Family Chiropractic, and we'll see you for our next workshop. So love to you.